Have you ever looked in the mirror and noticed something unusual about your skin, nails, or eyes? Maybe you brushed it off as nothing important. But sometimes, your body sends subtle warning signs long before serious symptoms appear. These changes don't always mean you have a disease, but they can be clues that something inside your body isn't working as it should. Recognizing these signs early can help you seek medical advice before a small problem becomes a bigger one. In today's video, we'll explore 15 strange signs your body may be unhealthy, explain what they could mean, and discuss when it's time to see a healthcare professional. Let's get started. 1. Bumps under the eyes. Have you ever noticed tiny yellowish bumps around your eyelids, especially near the inner corners of your eyes? These soft, slightly raised patches are often called xanthelasma. Many people think they're simply a cosmetic issue. While they can be harmless, they may also indicate elevated cholesterol or unhealthy blood fat levels. High cholesterol doesn't usually cause pain or obvious symptoms. That's why these bumps can sometimes be an early warning sign that cholesterol is building up in your blood vessels, increasing your risk of heart disease and stroke. Even if your cholesterol levels are currently normal, these deposits deserve medical attention because they may suggest an increased cardiovascular risk. If you notice these yellow patches appearing or growing, ask your healthcare provider whether you should have your cholesterol checked. 2. Spoon-shaped nails. Healthy nails usually have a gentle outward curve. If your nails become thin and curve inward like tiny spoons that can even hold a drop of water, this condition is called koilonychia. One of the most common causes is iron deficiency, especially when it progresses to iron deficiency anemia. Without enough iron, your body can't produce healthy red blood cells efficiently, reducing oxygen delivery throughout your body. People with iron deficiency may also experience fatigue, dizziness, headaches, pale skin, or shortness of breath. Less commonly, spoon nails can also be linked to thyroid disorders, autoimmune diseases, or inherited conditions. Because several health problems can cause this change, it's important to have your iron levels and overall health evaluated. 3. Cracks at the corners of your mouth. Small painful cracks at the corners of your mouth may seem like dry skin, but they can actually be a condition known as angular cheilitis. These cracks often develop because saliva collects in the corners of the mouth, allowing bacteria or yeast to grow. However, nutritional deficiencies can also contribute, particularly low iron, vitamin B2, vitamin B12, or folate. People who wear dentures, have diabetes, or have weakened immune systems may also be more likely to develop these sores. If the cracks keep coming back despite using lip balm, it's worth asking your doctor whether an underlying deficiency or infection could be responsible. 4. The ring around your iris. Have you ever noticed a white, gray, or bluish ring around the colored part of your eye? As people age, this can be completely normal and is known as arcus senilis. However, if this ring appears before age 45 or develops unusually early, it may be associated with high cholesterol or inherited lipid disorders. Excess cholesterol can accumulate in different tissues, including the edge of the cornea. Although the ring itself doesn't affect vision, its presence in younger adults may indicate a higher risk of cardiovascular disease. A simple cholesterol test can help determine whether further evaluation is needed. 5. A white-coated tongue. Your tongue naturally contains tiny bumps called papillae. When dead cells, bacteria, food debris, and proteins become trapped between them, the tongue can develop a white coating. Sometimes this happens simply because of dehydration, poor oral hygiene, smoking, or mouth breathing. However, persistent white patches may also indicate oral thrush, especially in people with diabetes, weakened immune systems, or those taking antibiotics or inhaled steroids. If brushing your tongue doesn't remove the coating or it keeps returning, it's a good idea to have it checked by a healthcare professional. 6. Losing the tail of your eyebrows. Take a close look at the outer third of your eyebrows. If that section gradually becomes thinner or disappears, it may signal more than normal aging. One possible cause is hypothyroidism, where the thyroid gland doesn't produce enough hormones. Thyroid hormones help regulate metabolism and influence hair growth throughout the body. People with hypothyroidism often experience fatigue, weight gain, dry skin, constipation, depression, and sensitivity to cold. Because thyroid disorders are common and treatable, this subtle eyebrow change can be worth mentioning during a medical checkup. 7. Dark patches on the neck. Velvety patches on the neck, underarms, or groin are often called acanthosis nigricans. These patches aren't caused by dirt and usually can't be scrubbed away. In many cases, they develop because the body has become resistant to insulin. Insulin resistance means your cells no longer respond properly to insulin, forcing your pancreas to produce more of it. Over time, this can progress to type 2 diabetes. These skin changes can appear years before diabetes is diagnosed, making them an important early warning sign. If you notice these dark patches developing, especially if you're also overweight or have a family history of diabetes, ask your doctor about checking your blood sugar. 8. Slow healing wounds. Most small cuts and scrapes begin healing within a few days. If minor wounds seem to linger for weeks or repeatedly become infected, your body may be struggling to repair itself. Poor wound healing is commonly associated with diabetes because high blood sugar damages small blood vessels and nerves, reducing circulation and slowing tissue repair. Other possible causes include poor nutrition, vitamin deficiencies, poor circulation, immune disorders, or smoking. Persistent wounds should never be ignored because they can increase the risk of serious infections. 9. Always cold hands and feet. Some people naturally have colder hands and feet than others. But if you're constantly cold, even in comfortable temperatures, there may be an underlying medical reason. Poor circulation can reduce blood flow to the extremities. Iron deficiency anemia limits oxygen delivery throughout the body. Hypothyroidism slows metabolism, making it harder to maintain body temperature. Some people may also experience Raynaud's phenomenon, where fingers and toes temporarily turn white or blue in response to cold or stress. If cold extremities are accompanied by numbness, color changes, or pain, medical evaluation is recommended. 10. Unexplained bruising. Everyone bumps into things occasionally. But bruises that appear without remembering an injury, especially if they happen frequently, deserve attention. Easy bruising can occur because of aging skin or certain medications like blood thinners. However, it may also result from vitamin C deficiency, vitamin K deficiency, platelet disorders, liver disease, or blood clotting problems. If bruising becomes frequent, unusually large, or occurs alongside bleeding gums or nosebleeds, you should seek medical advice promptly. 11. Clubbed fingertips. Healthy fingertips usually have a gentle angle where the nail meets the skin. In clubbing, the fingertips become enlarged and rounded, while the nails curve downward. This change develops gradually over time. Clubbing can be associated with chronic lung diseases, lung cancer, certain heart conditions, inflammatory bowel disease, or liver disease. Although not everyone with clubbing has a serious illness, this finding should always be evaluated by a healthcare professional because it can signal long-term low oxygen levels. 12. Yellow in the whites of your eyes. The white part of your eye should normally stay white. If it becomes yellow, this condition is known as jaundice. Jaundice occurs when bilirubin builds up in the bloodstream. Possible causes include liver disease, hepatitis, gallstones, blocked bile ducts, or disorders that break down red blood cells. Unlike yellowing caused by certain foods affecting the skin, jaundice changes the whites of the eyes. Because it may indicate significant liver or biliary disease, yellow eyes should always be evaluated promptly. 13. Pale inner eyelids, gently pull down your lower eyelid. Normally, the inner surface appears pink or reddish because it's rich in blood vessels. If it looks unusually pale, it may suggest anemia. Anemia reduces the number of healthy red blood cells available to carry oxygen throughout your body. Common symptoms include fatigue, weakness, dizziness, headaches, and shortness of breath. Although pale eyelids alone cannot diagnose anemia, they can be a useful clue that a blood test may be needed. 14. Ridges across your nails' horizontal grooves running across your fingernails are called Bowes lines. Unlike normal vertical ridges that often appear with aging, these horizontal lines can develop when nail growth temporarily stops. This interruption may occur after severe illness, major surgery, high fever, chemotherapy, significant stress, or nutritional deficiencies. Because fingernails grow slowly, these lines can actually record events that happened months earlier. If multiple nails develop deep horizontal ridges without an obvious reason, discuss them with your healthcare provider. 15. Relentless occasional itching is completely normal, but persistent itching without a visible rash can sometimes signal an internal health problem. Chronic kidney disease, liver disease, iron deficiency, thyroid disorders, diabetes, and certain blood disorders have all been linked to generalized itching. Dry skin and allergies remain much more common causes, but itching that lasts for weeks, worsens over time, or interferes with sleep deserves medical attention, especially if it's accompanied by weight loss, fatigue, yellowing of the skin, or other unusual symptoms. Don't ignore it. Conclusion: your body is constantly communicating with you. Sometimes, the smallest changes in your eyes, nails, skin, or mouth can provide valuable clues about your overall health. Remember, these signs don't automatically mean you have a serious disease. Many have harmless explanations, and only a qualified healthcare professional can make a diagnosis. But paying attention to these warning signs and getting them checked when they persist can lead to earlier treatment and better outcomes. If you found this video helpful, give it a thumbs up, subscribe for more evidence-based health content, and let us know in the comments which of these warning signs surprised you the most. Thanks for watching, and we'll see you in the next video.